Being a cardiac surgeon is still a very interesting and rewarding job. You have critical ill patients. You can help a lot of them by doing a good job. And that's what drives a cardiac surgeon, I think. I got two parents, they're doctors, both of them. And I started with general surgery, and then I got interested in cardiac surgery when the boom of the bypass surgery started. It's been a fantastic job, more than 30 years now. Teamwork in the OR is very important. We have the anesthesiologist, the surgeons, the nurses, and in cardiothoracic surgery you also have the perfusionist that runs the heart-lung machine. And they have to interact perfectly to get a good result. There are some cases you'll never forget. The case that is most clear in my mind was a young girl who has just given birth to her child, and 3 days after she suffered a massive pulmonary embolism and went into cardiac arrest. We took her to the OR and removed the pulmonary embolus, and outside were the father of the child sitting with the child in his hand, waiting for good or bad news. At that time it was luckily good news. The reaction from the relatives after surgery is very different. Some are very relaxed and someone is very upset, of course depending on the result of the surgery. The most difficult case was when I operated a colleague that didn't make it, and I knew the family. That was tough, really tough, but that's part of the job. After surgery, when you go home to your family, you always keep the tricky patients in your mind, and I always check them on the PC in the evening to see if they're doing well. Even though I'm not at call, all the doctors will call me if there's any problems with my patients, so I can consult with them. I always want to be a doctor. My parents liked it, so why shouldn't I?